could potentially have the virus, and therefore you take precautions. However, for clarity of the presentation, everyone can hear what I'm saying. Sometimes wearing the masks, you're muffled. I will remove my mask, but please be assured that each time I leave the microphone, I will put on my mask. And I guarantee you that everyone who I'm looking at here in our press room is wearing a mask and wearing it appropriately. We had a cabinet meeting yesterday, and all our ministers wore their masks, some even while making presentations. And they are indeed role models, they are examples, and in their ministries and for their constituents, I'm sure that they are emphasizing the wearing of masks. So, good afternoon, everyone. Those joining us online, those joining us by radio and television, and our diaspora overseas who are joining us. Let me start with our graphs. The graphs have become a feature of our presentation, and they obviously graphically display the situation that we face. You are now seeing the graph displayed, and you will see our black trending line, which gives the cumulative number of cases to date. My figures here tell me that we have 5,270 cases. The Minister of Health may give an update later on. He may have more current information than I do. But that is what we have, and I believe that would have been up to yesterday or today's date. Up to yesterday's date, right. Unfortunately, since our first case, we now have 75 deaths. And that is depicted by the red line. We extend sincere condolences to the loved ones of those who have passed. And this is, of course, a significant rise in the number of deaths. And indeed, it is of grave concern to the government and indeed to the nation. Every life is valuable. Some persons are known more than others, obviously. And we have had some icons in our society pass. We mourn for them. And their passing is indeed, for many Jamaicans, they use that as a signal of the seriousness of the pandemic. And as it should be, unfortunately, there are those who will only appreciate the severity of the situation by looking at deaths. That should not have been the case. The government and our experts have always been consistent and have gone to great lengths to explain to the population that this is a very dangerous disease and that complacency is something that we should never allow to creep in the management of the disease and in our own personal behavior. I do hope that as a society, we are all taking a greater level of compliance and seriousness in our daily behavior as it relates to consistently and faithfully following the established protocols and guidelines. You would now be seeing the green line on your screen, and the green line represents the number of persons who have recovered to date. And with the increase in the overall numbers, we were recovering nicely before. We had a very high recovery rate before. Now we are at 27.4% in terms of our current recovery rate, and that would be normal since we have had an increase in our overall numbers. The final line in this graph which is the blue line, shows that we have 3,688 active cases, and that is the number of persons who still have the virus, persons who have been confirmed as having the virus through testing. Now, I want to point out that we have an inflection point in our graph, meaning the point at which the trajectory of the growth in the number of cases would have changed. And that would be somewhere around between the 17th and the 21st on your graph. The CMO will probably point out from a statistical point of view where that inflection point would actually be. But as you look at the graph, you can see that the trend changed somewhere around that period of time. And that shows that something happened around that period of time. And from an epidemiological point of view, maybe you could track that to 2 weeks before, 14 days before. I make this point to say that what the government decides to do, what people decide to do, and how government and people cooperate can have an impact on the results of the pandemic. The numbers of cases that we confirm, the number of people who actually die. So the graph represents, if you were to look at it from start, the government trying very hard to contain the virus from the first case being confirmed on the 10th of March to a cluster outbreak somewhere around between the 11th and the 15th of April. We put in place measures which would have included containment measures for an entire parish, and we managed to control that cluster outbreak. And then we put in place measures to allow for the return of Jamaicans who were overseas, and then we put in place the controlled entry of Jamaicans and non-Jamaicans, and that worked very well from the 1st of June thereabout onwards to August. And then in August, several events would have happened. It all comes down to the consistency and faithfulness of compliance. We are now in a new phase of the pandemic, and that phase, we describe it as community transmission. It is a phase that we would inevitably reach. We would have wanted not to have reached it at this point or ever. It's just the way in which pandemics will unfold. It is not a fatalistic phase. It is not a phase in which we say we throw up our hands, we give up, we no longer try to bring the spread of the virus under control. No. Now is the time when we must redouble all our efforts as a nation to bring the spread of the virus under control. We, however, note that there are some fundamental changes in how the virus has spread. The CMO and the Minister of Health will give further details, but now the virus is in literally most, if not all, communities around the island. And that is the assumption and the posture that every citizen must take. Before, we could say it was in a cluster. We could identify it here, or we know these are the persons who are infected, and we could trace them back and connect them and put measures around them to contain it. Now we have to take a different approach. The current phase requires each individual to take their health, security, and safety into their own hands. And that means taking up their masks, taking up your mask, getting hand sanitizers and keeping them close by so you can sanitize your hands, engaging in regular hand washing where possible. Don't be afraid to say to someone, you're standing too close to me. Stand further apart from persons than you would before. If you see people gathered, you should be counting off. You don't want to be in a group of more than 15 persons. And if you find yourself in such a group, as much as possible, you want to maintain your social distance. The government will continue to put in place the measures that it has control over. And those measures are designed to control movement, because ultimately, the virus doesn't have legs of its own. The virus moves by people moving. And if you're moving in unproductive ways, in indiscriminate ways, then you could be spreading the virus and having an impact on persons and on the economy. But then again, when we put in place measures to control movement, we also have an impact on the economy. So it is best that each citizen, even without the government exercising control over movement, that each citizen becomes situationally aware and makes decisions about how and when and with whom they move. If every citizen were to act with this level of awareness, then the inflection point that I pointed out on the graph, we may still reach it, who knows, it will still happen, maybe there's something beyond our control, but we probably could have delayed it even further. And that is indeed the strategy. We are trying to delay that inflection point closer to the point where there is a vaccine, and for longer periods to allow us to build our capacity so that we are able to address those persons who get ill and give them the treatment necessary to ensure their recovery. So I was watching very closely what is happening in other countries in the world. We note that the United Kingdom has declared that they are going through a second wave. And I paid very close attention to what the UK Prime Minister has said. And I'm very curious because Jamaica has put in place most, if not all, the measures that they are now reinstating or now putting in place. So we have had our measures in place. What we really need to focus on now is compliance. And the government has not been ambivalent about the need for compliance, but Jamaica is a liberal democracy. And how government goes about enforcing compliance is not always a straightforward matter. We always have to consider rights. Jamaica has evolved a rights-based culture, and it has served us well, and it is good that we have a rights-based culture. And governments need to be able to navigate that and balance rights. And this government, like all governments in liberal democracies, have to work with that. We have to ensure that we respect the rights of citizens, because, believe it or not, as I speak, there are those who feel that putting on a mask and requiring that it be worn is an imposition. There are those who feel that, requiring vaccination is an imposition. But it is their right, it is their freedom to feel this way, and the government must respect that. The only way that we are going to get to the level of compliance is by ensuring that we maintain this connection, this communication, that I pay attention to what you are saying and I respond to what you are saying. I put the facts on the table, you put your facts, and we have this dialogue and communication. And the press plays an important role in bringing to the attention of the government concerns, in ferreting out information, in interpreting and analyzing information. And the government plays, of course, an important role in this, in ensuring that it is available and consistently present the information. I'm confident that we will reach that steady state. Yes, the upsurge that we have had in cases would have caused great panic, and I see it all across the society. And the deaths in particular would have raised even greater concern. I'm very careful when I say that the government, by virtue of understanding how pandemics work, planned for this eventuality. We understand that this would and could happen, and we planned for it. So the country should not feel as if, you know, the Ministry of Health is at sea or the government is at sea and this is happening and we are not in control. You will recall that in many of our press conferences, we have pointed out that this could happen. We were always trying to delay it from happening. It has happened at this point, and I'm particularly concerned about it happening at this point, because this is the point when we wanted to return our children to school. So we have had to take other decisions to ensure that reopening school does not contribute or drive any further increase in our numbers. But, you know, as a nation, we have the capacity. So I'm not worried, I'm not perturbed, I'm not in a panic. I'm quite clear that we will be able to manage it. And I reference what was happening in the United Kingdom, and I encourage Jamaicans to get wide information. Don't just focus on what is sent to you in your WhatsApp inbox. You know, go and do your research as well, and you will find that much of the information that is being sent to you is purpose-driven. In other words, there are ulterior motives behind it. The information is there, it's wide open in the internet, and I encourage you to be inquisitive and to find information. And you will see that this is not a unique situation or an unusual situation for a country to be in. Many countries around the world are going through this because this is just the nature of how pandemics unfold. What we are trying to minimize at this point is the deaths, because every life is valuable and every life is productive for the country. And so the government has to take steps and measures to preserve lives. Now, one of the main measures that the government has put in place, which I think has worked and served us very well, and I have observed that though the level of compliance which we started with may not be the level of compliance now, but there's still a fairly high level of compliance, would be the curfews. And you may ask, how do I know the level of compliance? There are some points when I have to leave here very late, or I'm at office late, and I'm taken home by the police escort. And I pay close attention. I look, I see what's happening on the roads. And I see a few cars still moving around. But by and large, I think people have followed the curfew. I do get some information from time to time, which I pass on to the relevant authorities, of people breaching the curfew, still keeping quiet parties in communities, and people traveling to and fro from those parties and events, breaching the curfew rules. I've had discussions with the Commissioner of Police, and we will now have to strictly enforce the curfew orders. So 2 weeks ago, we had announced tightening of some of our measures for an initial 2 weeks period. Given that we are now in what is called the community transmission phase, we will now extend these measures. So the island-wide curfew time will remain at 8 p.m. to 5 a.m. until 5 a.m. on the 7th of October 2020. Let me say a little bit more on the curfews. The business community and indeed the traveling public has raised concerns to myself and the Minister of Health regarding the 7 o'clock curfew. We wanted to tighten up the curfew, that is to go to 7, but the concern about people rushing to get home in that 1 hour period between the close of business and people getting onto public transportation, that may defeat the purpose. And not everyone would be able to go home and cook. Some people need to go to quick service restaurants and so forth. And we considered all of that. And we decided that 8 a.m. would be a good, 8 p.m., forgive me, would be a good curfew time. However, it is still having, and we acknowledge this, a negative impact on production, employment, and our economy generally. So the quicker we are able to bring the surge under control, it is the quicker we'll be able to restore our economy to close to full capacity in terms of its operation. And that really depends on how well people comply. That's what it depends on, how well we as individuals comply. A question was asked before in my last press conference, why not just scrap the curfews? What's the purpose of the curfews? The deeper understanding is that the curfews help us in controlling non-productive movements. So you really want to maximize your productive time, but time used that is not productive, you want to, as much as possible, control that. So the curfews help in focusing how we move. We move for productive purposes, we move for emergency and necessities, but if it is not productive, if it's not an emergency, if it's not a necessity, then we should not move. And if every Jamaican internalizes that and limits movement, then we will limit the spread of the disease. You will recall that when we saw the first signs of this in the early part of August, 1st of August actually, we explained that we picked up cases in St. Thomas that were linked to movement from St. Catherine. And as Jamaicans, we not only move right across the country, we move right across the world. So the quarantine measures will remain in place for people coming into Jamaica. And we urge every single person coming into Jamaica to respect the quarantine orders that you are issued. Because that is another important mechanism for controlling movement. Persons 70 years and older must continue to stay at home. But of course, you would know by now know that the order allows persons 70 years and older to leave their home once per day for the necessaries of life, which means that they can go to the closest practicable location for the purposes of obtaining food, medical supplies, conducting financial transactions, overseeing their place of business, attending a place of worship, and physical exercise. Given the high vulnerability of persons in this age group, particularly those with comorbidities, I cannot overemphasize the importance of strict adherence to this measure. Most of our deaths are persons in this category. While persons in this age group need to be extra careful and strictly follow the infection control and prevention measures, it doesn't mean that our younger persons don't have to follow these measures. I'm emphasizing for this cohort, but really everyone, including our younger people. And I hear say that our younger people have to also be vigilant and careful how they interact with our older population. Those who may be going to school, those who go to work, be mindful that whilst you may not have symptoms, so you are not tested, or there would be no cause for you to get a test, but you could have the virus, and you could pass it on to the older age cohort in your household or who you interact with. And so you have to be very mindful also about this. We had reduced the gathering limits from 20 persons to 15. That number will remain until October 6, 2020, and I dare say it will likely continue and probably be reduced depending on how we assess the situation. Many persons are not fully understanding what is the gathering limit, what's the intention of the gathering limit. Of course, the larger the gathering, the greater the probability of spread within that gathering, but it is also more difficult to track and trace the larger the gathering. Some countries have put in place a gathering rule of 6 persons, 10, and they're very strict in the observance of the gathering rule. We are at 15, and we will maintain it for the next 2 weeks. But as I've said, depending on how the numbers progress from the pandemic, we may very well reduce the gathering limits, which would have an impact on things like funerals and services and so forth. It is always a challenge when we see people, for example, gathering to pay bills at banks and the tax office and other places. That is an area in which we will have to pay closer attention as to how we treat with this. Indeed, we have as a government emphasized moving much of our payments away from physical presence to doing them virtually online. Many Jamaicans have not taken this as a serious and viable alternative. I'm using this opportunity to encourage every single Jamaican. If you can avoid doing transactions physically, you should. If you have not put yourself in a position to do virtual transactions, I'm appealing to you at this point to do so. To do virtual transactions, it may mean that you have to get a bank account. It may mean that you have to have internet access, and you may have to have a smart device. Smart devices are widely available, and the government has made it possible for you to access various sites, particularly those that have to do with conducting business with the government, that you could access those without charge. And we have put internet access in many areas across Jamaica, community access points, and in town areas. So the possibility exists for more Jamaicans to use whatever limited facilities they are, but to use it nonetheless to reduce going in to conduct in-present transaction or being physically present to conduct your transactions. Recognizing the risk of exposure during commuting, the provision of public transportation by motor car will continue to be limited to 1 person less than the maximum number of persons allowed to be carried under the relevant license until October 6, 2020. Now, let me say that I'm not all over Jamaica, so I wouldn't be able to give you a good assessment. I'm going to ask the Ministry of Transport to give me an assessment as to the level of compliance with this measure. From what I've seen, just moving about, that I'm not seeing a very high level of compliance. Neither am I seeing a high level of compliance by taxi drivers in wearing masks. I do see their passengers wearing masks, but I'm not seeing the taxi men. And when I do see them with masks, they have it under their chin. And I know it's difficult sometimes to breathe. If you wear glasses, your glasses is fogged up. But consider your life and the lives of the passengers that you're carrying. Now, based on the evidence of the risks posed by the gathering of persons for funerals, parties, and entertainment events, the prohibition on these will continue until October 6, 2020. We know that it is extremely difficult and painful to not be able to say goodbye to your loved ones at a funeral. I received a message from a member of a particular church who was appealing that their first elder, founding member of the church, passed, and they really wanted to conduct the funeral in the church. I'm very sympathetic to the position, but I'm also committed to ensuring that there is compliance with the rules as established. And there are many situations like these. I would suggest that they consider having a memorial service after we have reached a better point in the pandemic, but not at this point. Burials will continue to be allowed, but of course with the strict observation and enforcement of the 15-person rule, and the 15 includes no more than 10 mourners, with the additional 5 persons comprising the officiating clergy and funeral officials and those persons preparing the gravesite. Funeral processions are only allowed to include the hearse and the vehicles taking the officiating clergy and mourners. Normal church services operating in compliance with the established protocols have worked well, and they should continue. Congregants are reminded that gathering in excess of 15 persons are not allowed outside the place of worship. When the service ends, I'm imploring you to please leave the premises without congregating outside and return home safely. Having said that, I have seen some churches that are not following the protocols, that I'm still seeing huge numbers attending, and we would encourage those churches to reacquaint themselves with the protocols and follow them faithfully. These protocols were developed in collaboration with a representative body of church leaders, and I'm encouraging those church leaders who have been very good in their civic responsibilities to exert some influence on their brothers in faith to ensure that all churches are compliant with the protocols. I have with me here the Minister of Education, who I will call upon later on in the press conference to give us an update regarding the reopening of school. We had said in our last press conference that we are targeting October 5th. Minister Williams will give us a more comprehensive perspective as to how we intend to see to the reopening of schools. We're also encouraging all businesses to facilitate persons to work from home if they are able to do so. And let me just be clear, whilst we are not placing a mandate in the order for either the public service or the private sector, we are asking and appealing, encouraging and recommending to our private sector partners that where you find it possible, where it will not affect your productivity and your output, as much as you can, to arrange your business affairs to have your employees work from home. And the same message is given to the public sector, which I know has continued in that vein to allow employees to work from home. I wish to remind the country, however, that we have in the Disaster Risk Management Act some requirements. Employees who are immunocompromised, that is, they have an underlying illness that is not under control, they can request from their employers permission to work from home, and we expect that the employer would grant that permission. Employees who have no suitable arrangements to care for a child or suitable arrangements to care for an elderly family member or a family member with disability, they are protected under the Disaster Risk Management Act in the sense that they can request from their employer, and we expect that their employer will grant permission for them to work from home, and this should be without any disadvantage to the employer. Now, some persons have been asking, why are we not locking down the country given the sharp rise in the numbers? I want the Jamaican people to understand that lockdowns do not represent a sustainable approach to managing the pandemic. First, lockdowns have a devastating impact on the economy and therefore on livelihoods of Jamaicans. Second, unless there is a fundamental behavior change at the individual level, the same situation is likely to reoccur after you have lifted the lockdown. So yes, lockdowns still remain a tool in the toolbox to control the pandemic, but from the perspective of the government, that is not a tool that we should use now. The tool that we must use now is to heighten the public education, communication, moral suasion, and enforcement to generate a significant behavior change in individuals, our citizens, our Jamaican people. Once we have that behavior change, then if an event were to happen outside of all our efforts, notwithstanding our efforts, then you could apply a lockdown with the certainty that stopping movement, closing borders, and generally shutting down all activity, that once you bring it back under control, that the people understand, are compliant, are situationally aware, that lifting the lockdown would not see our population going back into complacency and careless behavior. So right now, the effort of the Ministry of Health, the effort of the government is promoting Jamaicans learning to live with the COVID-19 pandemic and following faithfully and consistently the measures that we have recommended. I want to say before I close my presentation a few things on testing. The Ministry of Health and Wellness has announced some changes in our approach. Effective October, we will be expanding our testing to include the use of antigen testing following the WHO PAO approvals. Antigen testing will be for persons who are symptomatic and will be done at suitable sites and approved laboratories. The implementation of the antigen testing will be piloted at major hospitals and health centers and at the National Public Health Laboratory. While the PCR test remains the gold standard, the antigen tests achieve a high degree of reliability at a fraction of the cost when they are used strategically. We will also be assessing and approving private laboratories to conduct COVID-19 testing. All private labs conducting testing will be mandated to report the results of their tests to the Ministry of Health. The requirements for entry into Jamaica under the Controlled Entry Program remain the same for both tourists and residents of Jamaica. However, given the high volume of applications, there have been delays encountered in the approval process. The ministry is considering options for expanding capacity to facilitate timely review and approval of applications. The Minister of Health had indicated that we are currently reviewing the requirement for pre-testing. The review continues, but let us be clear, pre-testing remains a requirement until our review is complete. Now, another touchy issue, one that has gotten significant attention, particularly in social media, and has been the subject of what I call some fake news, vaccines. Jamaica is a part of the World Health Organization COVID-19 Global Access Facility, or what is commonly called COVAX. The COVAX facility is designed to accelerate equitable access by countries globally to appropriate, safe, and effective vaccines. Once a safe vaccine becomes available, we are committed to making it available to all Jamaicans who wish to obtain it. Let me say that this is not the first time that we have placed this information in the public domain. I recall maybe 3 or 4 weeks ago, we made it absolutely clear to the public that once there is a safe, tried, tested vaccine, that Jamaica would ensure that we are able to access that vaccine and make it freely available to all who would want the vaccine. And I want to stress that. We will make it freely available to all who would want the vaccine. Jamaica has been very conservative, very cautious in approving and using new medicines, vaccines, tests. We have an ethics committee in the Ministry of Health. Our health professionals, sometimes I'm saying to them that you need to look at these things a little bit with a little bit more willingness to accept and absorb. But they maintain a very high standard. And they also align their approvals with that of the highest authorities on these matters in the world, WHO and PAHO. So we are not taking any risks with the health of our people. So once a vaccine is available, we look at it, we study it, and we conclude it is safe, then we will make it available to all who would want the vaccine. Let me say that vaccines work when you have a high percentage of persons taking the vaccine. So there has to be a high level of public education to get people to understand the risks and the safety dividend that you get from taking that vaccine so that you can make conscious decisions about your own health and security. So the Ministry of Health, the government in general, will be engaging a public education campaign to demystify, to place all the facts on the table so that our population does not have to listen to fake news and be dragged all over with information that has ulterior motives. And I encourage the population in this time of a pandemic to be careful of the information you consume. Not all the information that is out there is designed for your benefit. And you must always question, why is this information being sent to you? That is now the age of what we call information literacy. You're going to be bombarded with all kinds of information, all kinds of text message and WhatsApp message and YouTube and all kinds of things. Not everything that you consume informationally is true. You must question it and seek your own information as well. So there is no mystery about Jamaica's participation in the global access facility, where over 100 other countries in the world are participating. And what Jamaicans need to be mindful of is that without this kind of facility, vaccines could be developed. And the richer countries who have the resources and who develop the vaccine in the first instance, they would be in the front of the line. And they would be able to vaccinate their population while we are here debating fake news and all kinds of issues here, not having access to a vaccine to help us to get our economy on track. So the COVAX facility is designed to ensure that countries like Jamaica, poorer countries, who we can't develop any vaccine for ourselves here, the cost of doing that is prohibitive. But we are human beings and citizens of the world, and we too should have fair and equitable access to the vaccines that are tried, tested, and proven to save lives. And therefore, Jamaica's government has a duty to ensure that we are well placed in the line to get such a vaccine should it become available, so that you can be safe. So, from the beginning of the pandemic, we have committed that we will be transparent, that we will be evidence-based, situationally appropriate, and that we will communicate with you directly and consistently. We have said that we are protecting lives and livelihoods. There are some who feel that that is a trade-off. It is not a trade-off. It is not one or the other. We must do both. And I believe that we have done a fairly good job in keeping our economy moving, protecting those who are vulnerable, and controlling the spread of the virus. Ladies and gentlemen, thank you for listening, and I will invite the Minister of Health, if he wishes to add anything to what I have said or to give any new information, to now join you at the podium.
Thank you very much, Prime Minister. And you've said a lot and most relevant to what is happening. So I will be brief. Colleagues, distinguished ladies and gentlemen, of course, the regular updates, I want to just reiterate again that some changes have been made. And so at 10 a.m. each day, we update the ministry's website for the latest figures as it relates to the COVID numbers, whether it's positive cases, hospitalization, deaths, unfortunately, and all the other relevant information that we would normally release. And that will be for the last 24 hours. So I take note that there are some queries sometimes about the updates. Just want to reiterate that you can get that information. There is no intention to keep that away from the public. We have approached this process in a very transparent way. And so just visit the website of the Ministry of Health and Wellness at 10 each day or after 10 o'clock, and you'll get the regular updates. I think the Prime Minister has spoken to the most recent update, which is that we have 5, unfortunately, deaths in the last 24 hours, a 61-year-old female from Kingston and St. Andrew, a 54-year-old male from Kingston and St. Andrew, 52-year-old female from St. Catherine, 82-year-old male from the KSA, and a 93-year-old male from St. Mary. 4 of the 5 deceased have confirmed pre-existing conditions, and of course we express condolences to the family members. The deaths now stand, COVID-related deaths, at 75. The current numbers are 5,270 COVID-19 cases, with 127 new positive cases in the last 24 hours, and recovery is at 37. Recoveries have also increased by 37, bringing the total number of persons who have recovered and have been released to 1,444. The number of active cases, there are currently 3,668 active cases being monitored across the country. And I just want to say that in terms of active cases, there are 3 main categories for the treatment of active cases. The more severe cases are, of course, in the hospital setting where they need specific medical care. So those are the persons who are ill as a result of COVID, those who are requiring some attention but not as severely ill, maybe in a institution that we have put together or leased, and there are a number of them across the country that is manned primarily by our nurses and doctors. And then the vast majority are placed in their own personal surroundings, their homes. And just bear in mind that we would not have locations to place everybody in an institution. For those who are within their homes, we encourage them, where you have issues, you follow up with your health centers, you follow up with your hospital, you follow up with a toll-free line. If you don't have issues, meaning you're asymptomatic, it doesn't mean that that gives you the green light, if you will, to go around and to interact. You must maintain the clinical guidelines, which is for the 14-day quarantine period to be observed. In terms of the homestay, we have quarantine, that is, we have some 23,696 persons in home quarantining. The Prime Minister spoke about testing. Just to add to that, that we have ordered some 80,000 of the antigen tests, and that order is within the same framework that you explained, Prime Minister, around the global approach to access those tests at a particular price and to ensure that we access those tests. So it's no different from the approach to the vaccines. And this is necessary, and it is not the first time we have engaged this process. We are part of a global community, and this is a global pandemic. So we have ordered those kits. The next stage would be for site selection, where the tests will be lodged for administering. And in the first instance, that would be in our public health institutions, our hospitals and health centers, and we will ensure a distribution across the country, so access is relatively easy. The other phase, which is now taking place prior to the tests coming here, would be for training to take place, both in our public institutions, but also, very importantly, in the private entities that we will be working with. So selecting those private entities, training them, so when the tests actually arrive sometime in October, persons will be au fait with the technology and be able to administer those tests. And as the Prime Minister rightly pointed out, the tests will be more effective, or is more effective, in the case of symptomatic persons, persons who have the symptoms, coughing, sneezing, cold, fever, that sort of thing. And it's very accurate, I am told by the clinicians, I think up to 90+% when one is symptomatic. So we expect that the antigen tests will significantly ease the burden on the wait that persons sometimes experience because they've had to wait on the PCR test, which is the gold standard, but does involve moving samples from location to the lab, either at UWI or to the public health lab, testing in batches or administering the samples in batches. And this is why we have days of wait. And of course, when you have downtime, that is amplified. The antigen test will be far more easier to administer, a half an hour process or so. So we anticipate that when that is institutionalized, we will have a lot less challenges as it relates to testing. The other point I'd like to make, Prime Minister, which you did not mention, which I think is important, is the issue of the field hospitals. We have commenced the process of building out additional bed capacity captured under the theme of field hospitals, meaning that they are temporary, but the truth is they will be there even after COVID, so maybe that's not the right word. Nevertheless, the first one is a collaboration with the United States government, and that was delivered last week. The facility is now being installed at the National Chest Hospital. It's a 40-bed facility, and we have had some differences in the numbers, but I think it's 40 beds to confirm, okay, in the first instance, that is. And there'll be an official handing over this week, I think it's Thursday, and shortly after, that facility will be commissioned for use. And we're putting in place all the equipment that's required. It does come with some equipment. We will add some additional equipment and, of course, the personnel to man that facility. The other will be a facility, again, 40 beds, that will be based at the Mandeville Regional Hospital. And that is being negotiated with a Canadian company with the support and assistance of the Canadian government. And that discussion is in full train, and we hope to have the arrival of that facility in short order. And the same would apply as we're doing with the one at the Chest Hospital, but that would be in the center of the country. Then we have two others that we are going to be building out, meaning building a frame and then equipping them. One will be at St. Joseph's Hospital, which is a 36-bed facility, and that will commence shortly, I'm told. The other will be in the west, Falmouth Hospital, a 36-bed facility. So all told, we're hoping to add 152 beds in short order that will be committed to the COVID response, meaning to those who need hospital care. And we will say more and provide more information on that as time progresses. But that is in keeping with our commitment to ensure that we can manage any possible extreme flow of persons needing hospital care, that important category of positive cases, persons with symptoms who need hospital care. The final point I wanted to make, Prime Minister, again, that was mentioned, is that the community transmission phase requires an approach that we are going to be, that we have embarked on, and we are going to be more engaged with the populace in helping them to appreciate what community transmission means. I mean, we've said it, but I think we need to repeat it and keep saying it. What our role is as government, as public health, as all of the ministries of government, what the role of communities, workplace, particular sectors, institutions, because the reality is community transmission requires all of us to play a critical role. I mean, the government alone cannot do it, because by the very nature of community transmission, it means the virus could affect anyone at anywhere at any particular point in time. It means we must always assume that the person we're interacting with could potentially be a carrier of the virus. And it's a natural progression, by the way. It's not an error on the part of government strategy or policy or response. It was always predicted. It is a serious phase because it affects more people. And so we have to be keen, we have to be deliberate, and we have to follow through. But it is the point of the virus that requires the most people participation. For starters, to know what your role is, and secondly, to comply with the protocols. The Prime Minister has extended a lot of time on that, and rightly so. In terms of the workplace protocol, we have completed a revised workplace protocol, and we are now communicating with employers across the country, starting with the umbrella bodies, the PSOJ, the Chamber, the Jamaica Manufacturers Association. And the idea here is to find a way as best as possible to balance the necessity of pursuing work while mitigating against the risks that are involved in the COVID pandemic environment. So how do you protect yourself while you go to work and interact, whether with co-workers or customers? And how do you ensure that others around you are similarly protected and are safe? And the idea is that locking down and retreating is going to have, or has had, the consequences of lack of productivity, lack of earning, and all the other economic downsides that clearly has negative impact on the society. And indeed, as the Prime Minister said, it does not solve the problem because you're going to have to open up at some point. So the question is, how do you manage that? So the protocol that we have developed in consultations with a number of stakeholders, I have had a meeting with the PSOJ executive team. We have gone through elements of the protocol. And the challenge is measures within the new protocol seems to be different and indeed may even contradict the practice prior to this phase. So the idea, for example, of shutting down when you find a case in your organization, the new protocol is actually saying, don't shut down for deep cleaning, clean consistently and more frequently. So if someone is indeed positive, you extract them from the environment, you may do some special arrangements in and around their immediate vicinity, but work should continue. And it runs counter to what many companies have been doing today, where if they find a positive, they shut down for 2 or 3 days. The challenge with that is that because the virus is so widespread, to shut down for 2 or 3 days because you have a positive case may mean you'll be shutting down for a very long time, because there's always going to be someone in the environment who may be positive. So it's about management must actively participate, firstly, in communicating with workers in terms of what they do, the wearing of the masks, the other important things. Measures at the workplace geared towards knowledge that are working alongside persons with COVID, assuming that your neighbor in the work may just have COVID. We hope they don't, but it's very possible in the current scenario. So help them to follow the protocols if you are following it and they are not, the wearing of the mask, for example. Daily cleaning schedules must be adequate to make the environment safe for everyone. So again, how you apply cleaning. If you notice, when I came up here, someone came and they did the spraying down and the wiping down. We're going to have to make that more the norm now to reduce any possible risk of cross-contamination, even though I know you're negative, Prime Minister. Infection control measures required all the time, and with community transmission, the likelihood of exposure is real wherever and whenever. So those are the sort of 5 key principles that will guide the new and revised workplace protocol. And our objective as government, mine as the minister with this responsibility, is going to be out there. Indeed, when I leave here, I'm visiting a facility where myself and the president of the Manufacturers Association will look at that production line and we'll discuss and try to get that message out. And I certainly want to commend that to all employees. Visit our website. You can get a copy of the protocol. If you need additional information, please feel free to contact your association or contact the ministry or the nearest public health facility. Thank you.
Sure you don't want to do it again? Thank you, Minister, for the presentation. I'll now ask the Minister of Education to give the nation a report as to the plans and procedures that the Ministry of Education intends to put in place for the reopening of school. Minister.
Thank you, Prime Minister. Colleague ministers, PSs, members of the media, good afternoon. Let me begin by saying that in a meeting yesterday with the recently constituted Jamaica Education Transformation Commission, chaired by Jamaican-born Professor Orlando Patterson, who is a historical and cultural sociologist at Harvard University, he reminded us that the education sector in Jamaica is in crisis. 66% of our males are failing mathematics. 57% of them are failing science. 55% of males are failing language arts, and 50% are failing social studies. While less of our girls are failing, the numbers are still cause for concern and alarm. 51% of females are failing mathematics. 44% are failing science. 35% are failing language arts, and 37% are failing social studies. Additionally, of the 32,617 students who sat the CSEC, only 9,234 passed 5 or more subjects with English and math. Maths and English, as you're well aware, are the building blocks of a solid formal education. So there is an urgency for us to get all students back in the learning mode as regards to formal education. But having said that, we recognize that we are in a pandemic like no other, where fears are high, where fears and anxieties are high. I know that the ministry has been working assiduously based on the many briefs that I've had in the past week. I've also used the time to meet with the leadership of the JTA. I've had meetings with Book Fusion to discuss the e-book transition process. I've met with the book industry of Jamaica to discuss the plans for the availability of e-books, and they have promised a draft plan to be submitted by their association to the ministry. We've had meetings as well with e-learning, USF, NWA, with regards to connectivity in schools and in communities where students live. This morning, we met with principals and chairmen of the boards of management of high schools, and we have plans to have more frequent meetings. Tomorrow, we'll meet with principals in primary schools, tomorrow we'll meet with principals in primary schools. You would have also heard about the establishment of the Education COVID-19 Management Task Force, e-COVID for short. This task force includes key stakeholders in education and focuses on the following objectives: to develop strategies to support the reopening of schools in the COVID-19 pandemic environment, to build consensus around the roadmap for the safe reopening of schools, and to engage in an ongoing assessment of schools post-school opening. The task force will continue to meet on a regular basis as frequently as required. Today, we are confirming that schools will be considered reopened on October 5th, 2020, to deliver formal education to students. The important question is, what approach will schools use to deliver the teaching and learning experience? Schools will use a combination of approaches. First approach is the online approach, in which students remain at home and access lessons via the ministry's learning management system, in which teachers and students will be in a virtual environment. The teachers will be able to teach online, the lessons will be recorded, and the students will be able to access at their convenience and as many times as they would like, and this, we believe, will help to improve the mastery of the subject matter. Approximately 20,000 teachers have been trained on this online learning management system, which is a cloud-based system. The second approach is that the ministry will be providing lessons or the platform for lessons using TV, cable, and radio. TVJ will be providing a dedicated channel for 24 hours, and also CVM, in collaboration with Ready TV, will also be providing a 24-hour dedicated station starting on October 5th. Students will get classes via TV, cable, or radio, and the ministry will provide the schedule. The third approach is that the ministry will provide printed material for students to utilize along with their textbooks and worksheets at home. These will be delivered to agreed drop-off points and at home, and this approach is particularly applicable for students without internet access. We recognize that schools can and will use a combination of these approaches where possible and appropriate and safe. Many principals have asked us about the possibility of students coming to the classroom, especially for those schools in remote, deep rural communities. Principals have even said to us that they'd like to be able to focus on the exam cohort, and in some cases where there's a lack of supervision at home of students by their parents, they would like those students to come into the classroom as well. We're going to be guided by the health-related information, the completion of the health inspections in schools, and so over time, depending on how we move through this pandemic, we will know better how to bring students back in the physical environment in a safe way. Let me now turn to devices and access. The ministry has targeted grades 4 to 6 and grades 10 to 13 for distribution of devices. The total number of students in grades 4 to 6 is roughly 110,000, and in grades 10 to 13, we have about 130,000 students. In terms of affordability, the ministry is discussing what's called reverse billing with the carriers for access to the learning management system, and this will be applicable to students with devices and connectivity. So the ministry will be looking to pay the cost of students and teachers utilizing the learning management system. I'd like to remind parents and students as well that there are many educational websites that are zero-rated, meaning you do not have to have a data plan to access those sites, and we will continue to advocate for these to remain zero-rated. In terms of the tablets for teachers, e-learning has confirmed to us that all 25,000 teachers were given tablets. They've completed the distribution of that. The ministry will also be looking at connectivity at community centers in communities, at churches that are willing to have equipment so that students will have additional connectivity in their communities. Prior to the onset of the pandemic, the ministry was looking at advocating a bring your own device to school. And the ministry did go forward to put together a policy to guide that, it gives the background, the rationale, and the general guidelines for schools from early childhood to secondary schools seeking to implement a bring your own device policy. The final draft of that policy has been completed and will be sent to all schools within the next 2 weeks. I bring this up because the policy will provide the basis on which the government can begin to see how best to provide financial support for students who are not on path to be able to purchase their own device with the specifications provided. We have been talking to several retailers, several providers, and they have indicated as well their willingness to provide payment plans so that parents who cannot afford the upfront cost of these devices in one shot, they will be able to choose different payment plans. And as an example, there could be a payment plan stretched over a 12-month period or a 24-month period that would help with the affordability of these devices. We're looking as well at the feasibility of purchasing the Chromebooks. Some of you might be familiar with this, a combination laptop and tablet, and we've asked eLearning to do an assessment for us and to get back to us in short order. With regards to textbooks, the ministry has commenced the distribution of hard copy textbooks to schools for further distribution to students. All students at the primary and secondary level in the public schools will receive hard copy textbook. Additionally, 20% of books on the approved government textbook list are now being procured in electronic format for the secondary level. Once they are available, they will be on the Book Fusion platform to be accessed via their app, which will be in the Play Store. Electronic material and other electronic support are being provided through the ministry's app, being powered also by Book Fusion. On the topic of regular grants for school, 100% of the third tranche of regular grants have been paid to primary and secondary school. The overall amount is $1.4 billion. Regular grants for both independent and special needs school will be dispersed during the next week. On the vexed issue of parental contribution to schools, since schools are not physically reopened, there should be no demand or pressure on parents for these contributions. In fact, we are encouraging parents to use these resources to purchase devices, books, and data plans for educational purposes. Parents have been raising concerns regarding parental contribution to schools. It is not mandatory, and parents should not be made to feel that they must pay. The policy of this government is that no student should be denied access to education because of their inability to contribute. With regards to school feeding, the ministry will continue to provide the lunch and breakfast subsidy for students on path through the Ministry of Labor and Social Security to parents starting October 2020. Teacher training through UWI Open Campus, Micro University, Northern Caribbean University, Delaware University, and Waldorf Universities remain ongoing. The Jamaica Teaching Council has ongoing training and professional development webinars for teachers in the following areas: the blended approach using the STEM methodology, G Suite to include Google Classroom, which is the same as the learning management system. Over 20,000 teachers have already been trained, and it will continue. In terms of tablets in school, just to mention it again, following deliberations concerning the approach to be used for distribution of tablets procured by e-learning, it was agreed that e-learning would assume the full distribution of the 40,000 tablets, and these tablets will be focused on students in PATH in our primary schools, and we'll be emphasizing grades 4 to 6. We will be purchasing an additional 25,000 devices, and these will be targeted for grades 10 to 13, again with an emphasis on PATH students. And as already said, e-learning has confirmed that they have completed the distribution of tablets to teachers. In terms of the total overall that will be spent on tablets and laptops, it's roughly $1.7 billion. Just to touch now on early childhood or Early Childhood Commission grants. The Early Childhood Commission has commenced the provision of back-to-school grants for the basic schools. A total of $13.5 million is being distributed to the Brain Builders Center, which offers support to children 0 to 3 years, while $30 million was provided for the procurement of sanitation material and PPEs for schools identified to be in need. These are being distributed to the basic schools. The officers continue to engage the schools as they prepare for that moment when they will operate in a physical environment. The ECC also has kits and activity sheets that they've been training parents in utilizing with guidelines such as 15 minutes for screen time, 15 minutes at a time for screen time, and no more than 2 hours for the day. These are what is being recommended for our young ones. The same general guidelines for primary and secondary schools are applicable to the early childhood education sector. In terms of private schools and support, the request to the Ministry of Finance and the public sector for salary support for independent schools has been approved. Based on the submission, all teachers will receive a one-off payment of $40,000, and support staff will receive a one-off payment of $10,000. The payment is being processed, and we will stay on that to ensure that that gets out successfully. So in summary, we are in a pandemic like no other in our lifetime, while at the same time, there's a crisis in our education sector to which we must respond. We commit to using all avenues to communicate with our stakeholders as frequently as possible to keep them apprised and allow their continued input into the process. We understand how fluid the situation remains and that we will have to reconvene many times to continue to refine this process in the best interests of our students. Thank you very much.
Thank you, Minister. Naomi, if there are questions, well, there must be questions. So.
Thank you so much, Prime Minister. In keeping, we had tested, of course, the system earlier. We're happy to report that our internet is very stable today, and so our media practitioners are able to join us and ask their own questions. I would encourage our media practitioners if we would be able to just get the COVID questions out related to the specific issue we're dealing with today first, and then we can take any other. And so even before we ended, Janet Silvera had her hand up in Zoom, and so we'll go to Janet first. Janet?
Thank you. Good afternoon to you. My question is to Favour Williams. I have about 3 questions. The Favour Williams-driven e-COVID task force appears to be at odds with some of its major stakeholders on the matter of face-to-face classes. Is the government still looking to phase in-person classes in October amid the spike in deaths and infections? And why was no health official named to the task force? Second question, is the government considering using public records or liaising with private healthcare providers to form a profile of locations with seniors with underlying illnesses, even anonymously, to better react or to prevent COVID spread among the vulnerable groups? And also, will the government raise the Heroes Day holiday curfew to a 3 p.m. lockoff as it did in Easter to prevent a recurrence of the Emancipendence spike?
Thank you, Janet. Minister Williams will
Sure.
respond to the
So,
first two.
With regard to your question as to health professionals on the COVID task force, at the ministry, we have a very close working relationship with the Ministry of Health. We can call on them at any point of the day or night for information, for data. And so if there is no person on that task force, it's because we have access to the Ministry of Health. It doesn't preclude us going forward from adding someone to the task force at all whatsoever, but it's just that having had this very robust access at that point in time, we did not name anyone specifically to the task force. And with regards to face-to-face instruction, as you might have heard just now, in terms of considering schools to be reopened on October 5th, there are 3 approaches that we've outlined. Approach number 1 would be the online environment in which the students remain at home. The second approach would be providing lessons using television, cable, and radio. And the third approach would be providing printed material for those students who do not have access to approach 1 or approach 2, or schools could use all 3 in delivering the teaching and learning experience. I also said that we recognize the situation, the pandemic that we're in, and that we will continue to work with the Ministry of Health and Wellness. We'll continue to look at the health data that they provide. We're seeking the completion of the health inspections in schools, and so over time, depending on how we move through this pandemic, we will know better how and when to bring back students into the physical environment in a safe way.
Thank you, Minister. Prime Minister?
I heard questions about the impending Heroes Day weekend. I think the public should be aware that we have given no approvals whatsoever for any entertainment events. We are taking a far more rigid approach to the public using places of amusement, beaches, and so forth. So we are expecting that for the Heroes Day weekend, there should not be much activities that would necessitate us in any way limiting the curfew hours. Nevertheless, we will continue to evaluate what the numbers are, the outturn for each day. And if we consider it appropriate, we will increase the curfew hours. So it is something that the public should prepare their minds for, because it is likely that we could do it.
Thank you, sir. Let's go over to Ms. Althea Saunders of the Jamaica Observer. Althea.
Hi, good afternoon. I have 2 questions. The first one is for the Prime Minister regarding the number of persons in gatherings. The government facilities where persons have to go to do transactions, some of those transactions cannot be done online. What specifically are the measures that are being put in place now to prevent the kind of mass gatherings that we continue to see, like at the tax office, for example? And the second question is for Minister Williams. What is the status of discussions with the 2 telecoms providers regarding internet access for students, especially in rural areas?
Thank you for those questions. Let me say that most of the government services can be done online. Those that are not presently facilitated online, I happen to know that there is a great drive, particularly through the Ministry of Finance, to move more services online. Now, if persons have to come in physical contact to do transactions, we encourage them to follow the protocols. Wearing masks, maintaining the social distance. We encourage those agencies that have to accommodate the public to do in-person physical transactions, that they do the physical distancing, they place the markers, and they place hand sanitizing facilities in accessible areas, and where possible, they do their temperature check and surveillance to ensure that persons who are in line or who come in and wait are not exhibiting symptoms. And I think by and large, most government agencies who serve the public have most, if not all, these measures in place. Notwithstanding all of this, we still see overcrowding, and it is something that is exercising the minds of myself, the Minister of Finance, and other members of the Cabinet as to how we can address this. Right now, we are focusing on the digitization of the economy, which will see even greater provision of services, government services, digitally. That will take some time, but we are accelerating that process.
Thank you, Prime Minister. Let's go over to Ms. Brittany. Oh, the Minister of Education will answer hers from Althea.
Okay. I think the question had to do with internet access for those schools that do not currently have access. So we know, based on the reporting from schools, that 238 schools or so have no access to internet. That information tells us that they are in communities that themselves may have only intermittent or maybe non-existent access as well. What we have done, we've already entered into agreement with one provider for to begin the installation of equipment so that 100 schools will be able to get it. Once that equipment is installed, we are told that it would be available. There'd be a range within which it would be available to students. Additionally, as I said in my presentation, we're looking at community centers. We have many such community centers, well over 380, probably 400 community centers, and many of them USF would have had some activity there, whether it would have been to put in devices in those community centers and or internet access. So we'll be looking at how best we can activate those community centers to give students in those communities choices or access to the internet. Additionally, for the 138 schools, we are already in discussion with the incumbent providers. They have given us proposals as to how they'll be able to reach those schools. And again, school is not in session, won't be in session, but the equipment would be installed there and the signal would then go out within a certain radius so that the students would have access to that. So we are very mindful of the importance of internet access, and we are looking at all the providers who have come to us on this to see what are the different services that can be provided and how we can use a number of different modalities to take internet connectivity to our students. Thank you.
Thank you, Minister. Now to Ms. Dion Jackson-Miller of RJR.
Thank you so much, Naomi. Thank you so much, Naomi. Minister Williams. Okay, forgive me. I'm going back to this because I've seen so far 3 different interpretations about what you said at the start of school, including mine. So I need to ask the question again. Would it be correct to say, I understood what you said, 3 modes of teaching, Would it be correct to say, though, that on October 5, when school reopens, there will be no face-to-face at all, and that the request for face-to-face made by some principals in special circumstances will be entertained on a case-to-case basis, but that will depend on what happens with the numbers? Or is it that on October 5, we may see some face-to-face? That's the first question, because I'm really unclear in terms of where we are with that. My second question has to do with the testing, especially with antigen testing now coming up. We've been getting complaints from healthcare workers and essential service workers that they are not being given any priority at all in terms of testing, that they've been waiting for weeks in some cases to get back test results. Is this something, why is this? And is this something that there is a plan to change? And third and finally, any comment on what appears to have been a breach of quarantine by Kanye West based on the social media posts we've seen?
The Minister of Health has asked me to apologize. He had to go to another event, but the CMO and PS are here, and between them, they will decide how they will answer the health question. Minister Williams will obviously answer your education question.
Okay. So this morning in a meeting with principals and board chairs, one principal raised the question about the alignment of schools reopening with students and that alignment with the gathering rules that we have. So you can see right away that there would be an issue in terms of students coming back to school for face-to-face. We would have to align those two. So I say that because, parents, teachers, principals out there, they're very keyed into the situation, and they ask some of the same questions. This morning, what we are saying is we've presented to you the ways in which schools will be considered open and the ways in which they can bring the teaching and learning experience to students. And again, it's the online, and the ministry has taken efforts to provide the material through TV, cable, and radio, and to ensure that hard copy material is delivered to students. So in terms of the face-to-face, right now, just to be direct, it's not one of the approaches that we are advocating right now.
If I could just follow up though, because that's different from saying the ministry is saying no face-to-face. In other words, if a principal says, okay, I have these 2 or 3 or 4 grade 6 form children, I absolutely need to bring them in. Is that allowed? Because when you say the ministry is not advocating it, that sounds like you're not recommending it, but that's also not a prohibition. So that's what I'm trying to understand. Is the ministry prohibiting face-to-face on October 5?
Yes, we are.
Many thanks.
All right.
I'm going to invite the CMO. Yeah, I noticed I didn't touch the mic or anything.
Okay, good afternoon, everyone. In terms of the prioritization of testing for healthcare workers and other essential workers, this is something that we are working on to try to get it correct all the time. One of the major issues that we have is that many times when the tests are done for these persons, we're not aware, and they come to us after a week, they don't get the results, and at that time, it's 1 test, 2 test all over the place. So it's difficult to be able to respond in that manner when the requests for results come. When we have a more organized approach and we know that a batch of testing is going to be done in response to an event, then we will get back the results in a specified time. However, we do recognize that there is need, that there's a specific channel for these essential workers, and we are working to improve on that.
Kanye West.
I knew Dion would ask that question, so I tried to brief myself on it. I have not fully briefed, however. My understanding is that the international artists visited Jamaica a few days ago, and he visited the Resilient Corridor. He stayed at a hotel in the Resilient Corridor, and he asked for permission to be able to travel outside of curfew hours because of his flight arrangement, so he would have to travel outside of the curfew hours. That permission was given. From what I've seen in the press, which I don't like to regurgitate because I don't have the facts of the full situation, my understanding is that he would have visited Buju Banton's studio. The circumstances around that would have to be thoroughly investigated. I don't have the details around that as to whether or not permission was given, how that was arranged, whether or not protocols were observed. The pictures that were shared on social media would have shown the international artist and our beloved Buju Banton in studio, presumably without wearing a mask. Based upon our protocols, the present measure requires the wearing of masks in public transportation. But as I said at the start of my presentation, we encourage all Jamaicans, even if you're not in public, even if you're not taking public transport, you're going to be around people that are ill. You don't know the circumstances of persons, that you should wear a mask. And that would be my comment on the situation.
Thank you, sir. Let's go over to Brittany Clark of Nationwide Radio. Brittany?
Okay, good afternoon, everyone. I just have one quick question. It's for the CMO. So in the ministry's updates, the deaths are usually reported, and most times they reflect the deaths in persons with underlying conditions. So this has been spiking a bit of panic among the vulnerable group because, they really feel as if they catch COVID, then it's really doomed for them. But does the ministry have a reflection of the recovery rate of those same persons with underlying conditions? So not necessarily the death rate, but the recovery rate of persons with underlying conditions. Thank you.
Hi. Yes, so in our press conference on Thursday last week, this question was asked, and I promised that on Thursday this week we would give a full report on those deaths, and in particular, the recoveries for our moderately and critically ill persons. So we are preparing to have that information to provide on Thursday in the Ministry of Health's press conference.
Thank you, CMO. Let's go over to 18 Degrees North.
Hello, good afternoon, everybody. I am asking two questions, one related to COVID and two related not to COVID. First question, the tracking that was data that was collected from individuals that were having to download this app once they got into the country. Has that information been destroyed? So that's question one. Question two, what is the current diplomatic relationship with Venezuela? And three, what is the government's position on whether it recognizes the head of Venezuela as Mr. Maduro or Juan Guaido?
In terms of the COVID question, which I would be prepared to answer, I'm not aware that the app does tracking. The app does geofencing, which sends an alert if persons go within a certain radius out of where the app registered their location. So the app is not designed to store tracking information, and that was not the scope that was given to the developer in developing the app. We tried our best to ensure that the privacy and the rights of individuals are respected. I will, however, just to be certain, double check with the police and the other authorities that are responsible for managing the app to ensure that there is no unnecessary retention of personal data and that we are compliant with our own laws regarding data protection.
Thank you, Prime Minister. Let's go to Vanessa Silvera of the GIS.
Good afternoon. I have two questions. both for the Prime Minister. One, is there a deadline on the movement of more GOJ services online? And two, the Prime Minister mentioned the availability of smart devices. Is consideration being given for concessions for the importation of these electronic devices, particularly for the teaching, learning, and doing business exercise?
Well, we haven't set a deadline, but we have some timelines that we want to ensure that we meet. The foundations of creating the digital society rest upon, one, getting in place our National Civil Registry and our National ID system. And those we want to have the legislation passed before the year is out. And we have already put in our key public infrastructure to ensure that there is a platform on which both public and private sector can traverse in terms of information sharing and accessing information as it relates to being able to identify persons who are operating on online services. So we have some timelines, as we said, by the end of the year we should have our information system in place. We should have completed most aspects of our key public infrastructure to have that underlying foundation for what we call the digital society and the digital economy. In terms of, what was your other question? Just remind me.
The consideration for concession,
for concessions.
So that more persons can get devices, yes.
Concessions are a broad spectrum of things. If you are saying, the removal of GCT and other custom duties and so forth, our fiscal policy requires that we maintain a frugal position. And what we'll try to do is we would ensure that whatever benefits that are given are targeted. So the removal of GCT, for example, would not be targeted. In other words, persons who would not need the benefit would get the benefit. So it is easier for the government to put the cash up front, which is what we have been doing. So yes, we have acquired, the minister just told you, somewhere in the region of 40,000 tablets. That is a concession. Government purchased it, including the GCT cost, and gave it to persons, students and teachers who needed it. If we did it the other way, then persons who had the income to afford it and to pay the taxes would get the benefit. And that would mean less of a benefit to those who need it. So our fiscal approach, that is the management of your public finance, requires us to take this very strategic and frugal approach in ensuring that the people who need the benefit get the benefit.
Thank you, Prime Minister. There are several newbies on the line as well from the Gleaner, including one, Mr. Romardo Lyons from the Star. Romardo? Romardo, are you hearing us? All right, while Romardo sorts out his microphone, let's move to Janella Perseus from TVJ. Janella?
Thank you so much, Naomi. I have two questions. The first is, how many persons have been prosecuted under the Disaster Risk Management Act? And I'm asking this question in the context of the wanton level of breaches. So, for example, you have the gatherings, people not wearing masks, etc. And the second question has to do with a review of the legislations. So there is a view in the legal profession that in its current form, the Disaster Risk Management Act has no bite. Now, I remember in April, the Attorney General promised a comprehensive review of the legislation, including the Public Health Act as well as the Quarantine Act, because these laws are archaic. Where are we in terms of the review?
Janella, good to hear from you. I don't have the statistics in front of me as it relates to the numbers who have been prosecuted. By now, I would venture a guess that it would be in the thousands that would have been prosecuted. I've seen that the police have stepped up their prosecution, and I am continually encouraging the Commissioner to ensure that the police force plays a greater role in the enforcement under the Disaster Risk Management Act. Janella, I totally agree with you, and I've said in Parliament, and the Attorney General also said in Parliament, and indeed at the time, the issue was raised by the opposition, that the current legislation that exists, even though the Disaster Risk Management Act is a fairly new act, I believe that would be a 2015 act thereabout, that yes, there are areas in the act that should be improved. And at that time in April when we discussed it, we did undertake, and we are currently doing that review. It is moving much slower than I would want, but it is a mandate now given to Minister Chuck, supported by the AG, to have these reviews done, seeing that we are not likely to have a vaccine within under a year, and we now have to focus more on enforcement to encourage behavior change.
Sir, it is 10 minutes past 2. I do know that you have other meetings today. We'll take, I believe Janet Silvera is saying that there was a question she had asked that was not answered. Ahead of Janet, though, who would wrap up our press conference, I'm not sure if Romardo, who was acknowledged earlier, is able to speak at this point. If not, I do have a question coming in from Damian Mitchell, who's having some technical problems on his side as well. He's asking, is the government considering the release of short-term, low-risk inmates as part of the COVID response?
It's an interesting question, Damian. I couldn't give you an answer for that. I'd pass it on to the Minister of National Security. It's a very interesting question and an interesting proposition, actually, but I couldn't give you an answer just now.
All right. I'm still not sure about Romado's microphone. Janet Silvera, though, apparently has a follow-up, given that she said there was not clarity on a question that she had asked.
Thank you very much. My question, this new question rather, I'm going to not bother to ask about the other question that I had asked. I want to find out about the timeline and projected cost for the establishment of the field hospitals in central and western Jamaica. In addition, I would like to find out from the Prime Minister, why hasn't the government shut down the operations of bars and churches with infections and deaths rising daily?
Well, whilst the Permanent Secretary or the CMO makes their way to answer the question on the field hospital, we have been tracking on a regular basis the compliance of bars, community bars, let me just be clear on that, community bars and churches. And generally we have seen a fairly high compliance on community bars and churches. And there's a distinction between community bars and other places of entertainment and amusement. So it is not to say that those areas are protected, that should the numbers justify, we wouldn't act. But as it stands now, providing they maintain the level of compliance, they will be permitted to continue to operate. The PS will, and when the converse is true, I have the Minister of Local Government and Rural Development here, that if they don't comply, we will have to act. And the key is compliance. Once you comply, which is the sign that we're learning to live with COVID, then we can go about our regular lives. It is when we don't comply that our regular lives get disrupted. Permanent Secretary.
Thank you, Prime Minister. Good afternoon, ladies and gentlemen. There are 4 facilities that we have utilized the nomenclature field hospital, and I'm told that it's quite loosely being used in this context. However, the first facility, as the Minister pointed out, will be a gift from the United States government, and that's a 40-bed facility. The second hospital will be a co-sponsored facility between the government of Jamaica and the Canadian government. And this facility, the Canadian government will be contributing approximately 100,000 Canadian dollars for this procurement of this facility. The other facility that we have will be constructed by the government of Jamaica at a cost of approximately $65 million. And that facility will be at St. Joseph Hospital. And that's a 36-bed facility that will be constructed. And the final facility will be at the Falmouth Hospital, and that facility also will be a 36-bed facility at a similar cost. So just to recap, one facility is a donation from the United States government. The second facility will be co-sponsored between the government of Canada and the government of Jamaica. And the third and fourth facility will be 100% financed from the consolidated fund under the budget of the Ministry of Health and Wellness.
You need a different type of disinfectant. But I want to thank members of the media. You have been very patient. We have had to adjust our start time because, as many of you would know, the United Nations has started. It's in session, and we've had to prepare our message, and so we had to shift our start time down. Everything is now being done virtually, and Jamaica is still participating, even if virtually, and we are still fulfilling our international obligations using virtual means, and we encourage Jamaicans locally to, as much as possible, use online services, use online transactions instead of physically gathering to conduct transactions. I think this is a safer way and a wiser use of our time and resources. Again, to the members of the press, thank you. To Jamaicans home and abroad who listen, thank you very much.
Thank you, Mr. Prime Minister, and thank you to everyone in the virtual space who've tuned in. Join us again at another point. We will certainly be briefing the country on all the matters that have been discussed.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.